Okay, thank you very much, and thank you for having me here. I'm already hungry, so I'll try to be fast so we can catch lunch. Tea doesn't substitute that. Now, my presentation is about medics in diaspora and about building partnerships. And as an example for that, I'm going to tell about our experience in the Sudan Doctors Union of Ireland and the Sudan Anesthetist Association and what we've been going through. So I have no interest to declare really, rather than that I'm currently the sitting president, which is today is my final day, frankly. Tomorrow we're having our annual general meeting in Dublin, and there will be an election of the new EC, so a bit of a burden off the shoulders. You're all cordially invited, of course, to join us in Dublin. I can't guarantee a good weather, as in here in Brighton. Dublin is a nice place to be if you haven't visited before. So I'm not going to drill into that. I'm sure all day yesterday and today people have been talking about immigration and why people immigrate, and a lot of people in the room would be immigrants themselves. But probably these are the top 4 reasons why people leave their homelands and pursue a career somewhere else. And this is by no means just a Sudanese phenomenon. I mean, in Ireland, the Irish consider themselves to be the most immigrant population ever. They think the United States should be called the United States of Ireland. They think Canada is part of Northern Ireland, and even in the Gulf and the Arab Peninsula, you'll find you'll be amazed by how many Irish are there all over the world. I think in Sudan, unfortunately, we might be following their steps, but I don't think we are widespread as they are. So, diaspora, especially in terms of health professionals, they do contribute to the development of the home countries, as you all know. I mean, if you don't do anything, you send some money back home. So, but a lot of other diaspora, they are involved in more active programs. And there's been also a lot of programs by the UN and international organization to mainstream these lost knowledge and talent to back home. So I'm sure most of you would be aware of the Transfer of Knowledge Talking program and other organizations such as the International Organization for Migration and the MIDA program. So as I said, this has been touched on already, so I won't drill into it. In Ireland, like any other Sudanese in the diaspora, there's been a lot of programs, quite unorganized for a long while now. And they've all been depending on personal perspectives of how they could help back home. So everything has been tried, and every specialty has once or twice been to Sudan, with some experts. We've been also sending equipments, anything from ECD dots to dialysis machines, anesthetic machines, to incubators, everything else. Huge problem with the customs, but then eventually it makes it there. But I think you would align with me is that most of these efforts, when they are fragmented, when they're not organized, when they're not synchronized, which was going back home, they don't really have the maximum output for them. Now, one of the projects we're really proud of in Sudan, and that was before even the union was formulated, was a partnership between Cork University Maternal Hospital, which is quite a big maternity unit. Cork is the second biggest city in Ireland after Dublin. They had a 5-year partnership program with the Untitled Maternity Hospital and the Fistula unit in the late Hospital of Khartoum, as I believe it is called now. And this 5-year program meant to train the trainers and to improve the standard of health delivery to the partners and to children and units. It was a wonderful program. It went on for 5 years as planned. It was evaluated periodically. We had visiting teams going out from Ireland, and there was also a couple of physicians who were taken back to Cork and trained and went back to work in the Fistula unit. So it really is a landmark in the cooperation between the two countries. And it was even awarded the Best Healthcare Awards in 2009. And you might notice some of the physicians there, obstetricians who are now working in the maternity hospital, was delivered by the Health Service Executive in Ireland. Now, when we come to talk about Sudan Doctors Union, it's a very young, very small organization. It's mainly was a response to the growing number of Sudanese doctors practicing and being trained in Ireland. Now, a decade or 15 years ago, probably the number of Sudanese doctors in Ireland would have exceeded 50. Now we're talking almost, we're approaching 600. There has been a huge efflux from Sudan and influx into Ireland for reasons I'll explain later. But historically, we were part of the Sudanese Doctors Union of the UK and Ireland. But as the growing numbers of the Sudanese doctors increased in Ireland, and as the difficulties and challenges increased, we went from the initially what was a branch and now is a separate organization, Sudan Doctors Union of Ireland, which is registered in 2010. I had the honor of serving in most of the executive committees, and as I said, I'm now the president for the last stage. So, understandably, our main mandate, the Sudan Doctors Union of Ireland, is towards our members. So these would be the Sudanese doctors practicing in Ireland. We do have a journal, Nadocteric, which is the doctor in Irish. And we've also tried to facilitate training opportunities for our young colleagues joining. And we also help them in their exams and getting the jobs afterwards and stuff like that. We also have this ambitious project in which we agreed with the health insurance company back home for fees that we pay for them in Dublin, that they insure our parents or loved ones back home, which I think is one of the main hassles that we all face. So as I said, members first, this is the house for the newcomers, we call it Azal. So all those arriving from Sudan, they are allowed to stay in this house. It accommodates up to 20, and for no or symbolic fees, according to where they're coming from. So if they're coming from Sudan, we don't make them pay anything. If they're coming from the rich Gulf countries, they pay €5 a day. And so it's excellent in terms of that. It takes one of the major headaches, setting people from coming to Ireland is where I'm going to live, what I'm going to do. So this would be a good starting point. You get to meet his other fellow colleagues. We organize tutorials and seminars and for those that appeared for the exam. It has been a good focal point, even if you just want to speak some Arabic and want to know what's happening back home, or you want to send money or want some medicines. This is a good focal point to go, and you'll always find somebody coming or leaving Sudan. These are some of my colleagues, Dr. Asad and Nosri, and they're just doing the tutorials for some of the candidates, exam candidates. We also have an introductory workshop that we do to newcomers, just to help them understand the different systems in Ireland. Simple things like the taxation system, the banking system, how to get your driving license and stuff like that, just to get them on the wheels and to start. So this is our primary mandate. But we also have another mandate towards back home. Now, this probably is not very clear, but this is I copied from the website of the Irish Medical Council. The Irish Medical Council only ratifies 5 countries to be exempted from doing what we call the press, which is equivalent to the PLAB in the UK, and one of them is Sudan. So you have Australia, New Zealand, South Africa, Pakistan after 2009, Sudan and Malaysia. And now this was a bit of news to a lot of people, but it didn't come haphazardly. We worked very closely with the Irish Medical Council. We went through the curriculum that they have for their interns and compared it to the curriculum that we have for our housemanship, which was equivalent to the internship. And we showed that we addressed the same competencies. And based on this, and it was a hell of a work with the Sudan Medical Council back home and the Minister of Health and the training department, the Irish Medical Council decided to exempt Sudanese from the exam. And once you achieve the level in the IELTS, the English examination, which shows that you can communicate properly, then you are allowed immediately to apply for jobs, which we thought is a big step. And this is probably what facilitated that a lot of young doctors now graduating from Sudan are taking Ireland as their first to come and train in their respective careers, because they don't have to go through the hurdle of the exam and stuff. Now, I'll go to the heart of my presentation, and it's mainly what we have been doing as a diaspora to help with training and medical education and services back home. Now, very clearly, Sudan Doctors Union, we are not an academic body. We're not a Royal College. Okay? We see ourselves as a group of Sudanese doctors who have shared responsibility and shared dreams of improving things back home, even if we didn't attain it for ourselves. So we try to facilitate between different training bodies. The training body in UK and Ireland pretty much are the Royal Colleges, while back home so the Sudan Medical Specialization Board is the Sohel body. So we try to facilitate people from different Royal Colleges going back home and try to help in developing the curriculum, in developing the exam, and eventually in improving the training standards. This is one of the visits, I think around 5 years ago, once we started. With Dr. Porton, he's the Vice President of the Royal College of Anesthetist. We try to conduct some lectures, and we also with the students, but more importantly, we try to meet the trainers and see how to improve the level of training. Now, I know that Sudan has, in the last couple of years, managed to be an exam center for a lot of Royal College exams, such as the surgery and the medicine, and probably the peds and the dentistry, I think, as well. In the union, we hope to ratify the degree. It's not just about opening an exam. I think, in my opinion, it's a bit passive just to open a center. Well, 5 minutes, sorry. Yeah. So what we try to do is to improve the curriculum so that the standard of the anesthetist or the physician at the end improves. This is also another initiative that we have in conjunction with our partners in the Sudan Anesthetist Association, the Sudan Lifebox initiative. It's a simple device, mainly a pulse oximeter on a heart rate, which we unfortunately lack in a lot of theaters. And I think by providing that, we will improve the perioperative morbidity and mortality. In the first step, we're targeting 50 devices so that we can cover Khartoum state. But by the rate that we're going, and hopefully that we're going to exceed that target very soon. These are our partners, mainly the Sudan Anesthetist Association is the local partner. We have a local charity as well, so and after that we have the surgeons now on board with us, and we have the college and the Lifebox Foundation, which is here in London. So another thing that we try to emphasize in our partnership with our counterparts in Sudan is that we don't give them fish, we teach them how to fish. So this is, for example, the local faculty that was formed after some basic introduction into intensive care training in Sudan. And we do support them for a while, but after that they stand on their own feet, which they have done, and they carry on their own courses and stuff like that. So, which I think is very important for the sustainability, because if you depend on the expert to go there annually and help, after a while you will have fatigue and you won't have enough numbers. This is also part of the work that we have done with the Sudan Medical Specialization Board. The provider at that stage was the vice president of the board, and I'm also within the association. So we do try to work through already existing channels. I don't think any work throughout, whatever you think about these channels, any work outside these channels is definitely dead. This is just another example of just last February in which we conducted the first symposium for obstetric anesthesia. Okay, also in conjunction with the Sudan Anesthetist Society. It was well attended. We managed to form a sub-society for obstetric anesthesia. Everyone who is involved in maternal health knows that the numbers really are shameful. In Sudan for maternal mortality. It's something we should be looking into. And we're hoping that at least by addressing one part, and that's the perioperative management of these critically ill participants, that we will improve the outcomes. A lot of issues in Sudan. There is no one bullet answer to help that. We have to be innovative. We have to come up with solutions. We have to think outside the box and see how we can improve. It's not, I don't think just having a stand with or against government policies will help. You have to negotiate your way somewhere in between, because at the end of the people, if the government isn't yours, the people are yours. I had the honor of working with this excellent team. Some of them are as young as graduates of 2012, but they're all keen to help back home, come up with fresh ideas, and contribute towards a healthier homeland. Thank you very much.